Hello, my name is Twila Brase. I'm president of the Citizens Council for Health Freedom. I'm also a registered nurse and a public health nurse. Our organization is patient-centered and freedom-focused. The mission of CCHF is to support patient and doctor freedom, medical innovation, and the citizen's right to a confidential patient-doctor relationship. We have a daily radio program called the Health Freedom Minute. Right now it's just in Minnesota, but we are nationally syndicating it, so it could be coming to a station near you. Our organization deals with state and national issues, even though we're located in Minnesota. Some of those issues include the patient-doctor relationship, individualized patient care versus rationing of health care, obamacare-controls and intrusions, medical privacy and genetic privacy, ownership of DNA, and the freedom-minded alternatives to government-run and HMO-controlled health care. Three of our key issues include national health care and the movement towards managed care for all of us without our consent, and medical privacy and genetic privacy and consent, patient consent for access to medical records. And then the third one is DNA ownership and the fact that all of us should own our own DNA from the time of birth. Right now at the Minnesota Supreme Court, there is a case pending for 9 families who are trying to fight for the ownership of their child's DNA, which was taken from them by the health department at birth. Some of the myths that we like to talk about that we know that the public doesn't understand is that HIPAA, the so-called federal privacy law, is really a no privacy rule. It allows all sorts of people, 2.2 million entities, to have access to your medical records without your consent. Another myth is that coverage is looked at as though it were care, but it's not. Coverage is not care. You can have coverage and be denied access to care. And one of the third issues that we like to talk about is this whole move toward quality health care. And we want the public to understand that quality health care really means physicians being compliant with what the government or the HMO wants them to do. And that's what's being called quality, when really it's all about compliance. We also have opportunities for involvement. You can come to our website and get access to many of our brochures. We also have the Health Freedom Watch. It's a publication that comes out quarterly in hard copy or monthly by email. You can get on our email list and get action alerts for how to contact your members of Congress or your state legislators. We also have the Baby DNA Dig. This is for parents who want to know what is happening to their child's DNA at the health department here in Minnesota or in any other state. And you can go to www.itsmydna.org and find out that information and find a letter to send to your state health department. We also have events with some speakers of interest, both on health policy and on freedom. So come to our website to get involved and to stay informed. www.cchfreedom.org and www.healthcarefreedom.us.